This is Martha Smith. Martha enjoys being active. She likes to go for jogs and spend time outside. But when Martha turned 25, she began to lose her balance a lot, lose her coordination, and feel a strange numbness throughout her body. Martha called up Dr. McGee for an appointment. Dr. McGee knew what may be the cause of her symptoms: multiple sclerosis. Multiple sclerosis is an immune-mediated disease where the body's immune system attacks the central nervous system. Antigens deteriorate the myelin sheath surrounding the axons of neurons. This causes the electrical signal of neurons to be greatly slowed and will become progressively worse over time. To Martha's horror, MS is uncurable. Martha, with no options to help her cure this disease, continued her life as normal as she possibly could. But she slowly began to have trouble jogging, and eventually walking too. At age 27, Martha needed a cane in order to walk. Her perfect vision began to blur, and her body was always in constant pain. She began having regular visits with Dr. McGee, receiving physical therapy, but nothing seemed to help her at all. At age 28, she was prescribed depression medication to help her cope with her emotions. Martha felt helpless. She was still young, but was unable to live her life as she would like to. At age 29, Martha shuffled into Dr. McGee's office with a walker. She was feeling so hopeless. Dr. McGee sat Martha down and said, "There is some news that I should tell you. A condition was just discovered called chronic cerebrospinal venous insufficiency, or CCSVI, and it has been linked to multiple sclerosis. Best of all, CCSVI is curable." CCSVI is a disease that is caused by the jugular vein and its reflux of blood back up into the brain, which can also cause severe nerve damage. The symptoms of CCSVI are identical to early multiple sclerosis symptoms. CCSVI is cured by a surgical procedure where a stent or small balloon is placed inside the jugular vein to expand it. This expansion will hopefully stop the reflux of blood and stop all symptoms. Martha was overjoyed. For the first time in a long time, she had hope. Then Dr. McGee said, "In 5 or 6 years, we can hopefully get you the surgery and hopefully relieve your symptoms." Martha's heart dropped. 5 or 6 years? I can't wait that long. I want the surgery as soon as possible. Martha did not understand how new this condition was. Few clinical trials had been done, and the surgery was not approved to perform in the United States yet. The surgery is dangerous. Even though it may relieve her symptoms, it may also cause blood clots, relapse, or even death. It would take 5 or 6 years for more trials and research to be done and for the FDA to approve the surgery. Martha knew she would have to wait and do more research to fully understand this new condition. She went home to learn as much as she could about her options. Dr. Zamboni first coined the term chronic cerebrospinal venous insufficiency in 2008. He also suggested liberation therapy as a possible cure. During the research and tests that were done for chronic cerebrospinal venous insufficiency surgery, it was found that there may be a connection between constricted blood flow and multiple sclerosis. It was found that multiple sclerosis patients have restricted blood flow in their neck and chest regions, similar to those with CCSVI. In order to test this hypothesis, surgeons placed stents in the jugular veins of patients with multiple sclerosis to see if it helped to relieve any symptoms. The data is very inconsistent. Outcomes from this surgery range from temporary relief to death because of infection or severe damage to the jugular vein. This is when the controversy erupted throughout the medical field. Since 2009, about 30,000 multiple sclerosis patients worldwide have undergone the chronic cerebrospinal venous insufficiency surgery. There is no treatment or therapy for multiple sclerosis, so many patients were very eager to try the surgery, even though the risk is high and few tests have been done to prove any kind of connection between the two. Because these high risk factors and ongoing research, many doctors are not comfortable performing the surgery on multiple sclerosis patients. Although patients with MS show all the symptoms of CCSVI, it is an entirely different condition and more serious. Martha was surprised to learn how many people have received this surgery already. It's not allowed to be performed in the United States, but it is allowed in foreign countries. Many multiple sclerosis patients travel to other countries to receive this surgery. In most cases, the patients will have severe complications or relapse. Complications of this surgery include movement of the stent, infection, damage to the blood vessel which could lead to clots, bleeding from blood thinners prescribed after the surgery, or a reclosing of the vein after the surgery called restenosis. After this treatment option was hypothesized to help people diagnosed with multiple sclerosis, they performed trial surgeries on MS patients. Researchers and surgeons have performed unblinded, non-randomized stenting procedures in patients with MS. Some saw symptom improvements, while some had the opposite effect. Because of so much conflicting data and minimal studies performed, conclusions can't be made for the helpfulness of this procedure. But this is the first step in a giant breakthrough in multiple sclerosis. If this correlation between blood flow reflux and nerve damage is legitimate, pinpointing the cause for multiple sclerosis could possibly be found. If more testing and better controlled experiments can be done, this can change what we know about multiple sclerosis. The U.S. Food and Drug Administration, or the FDA, statement was released in 2012 after many multiple sclerosis and CCSVI patients traveled out of the country to receive CCSVI treatment surgery and had complications or died. The FDA is alerting people of multiple sclerosis to the risks of serious injuries and deaths associated with the procedures to treat chronic cerebrospinal venous insufficiency. Therefore, the benefits of these experimental procedures have not been proven, and their promotion as a treatment for multiple sclerosis may lead people with the disease to make treatment decisions without being aware of the serious risks involved. This communication is also intended to notify physicians and clinical investigators planning or conducting clinical trials using medical devices to treat CCSVI that they must comply with the FDA regulations for investigational devices. Since this statement was released, more clinical trials have been performed, but still with no solid conclusions. Multiple sclerosis is a progressive disease that affects every person diagnosed differently. It is hard to solidify results from inconsistent data. The FDA also released separate statements for people with multiple sclerosis, physicians, and clinical experimenters for what course of action they should take when dealing with this matter. Since lives are at risk, the FDA is being very cautious with this subject. The National Multiple Sclerosis Society has also released a statement on liberation treatments for multiple sclerosis patients. The Society is committed to pursuing all possible avenues of research that can lead to improved treatments and ultimately a cure for multiple sclerosis. The hypothesis on CCSVI and its corrective treatments is a path that must be more fully explored, and one that we are supporting with research funding. Based on results published about these findings to date, there is not yet enough evidence to conclude that obstructions of veins causes MS, or to determine when this obstruction may occur in the course of this disease. Endovascular surgery, like any surgical procedure, carries some risk. This does not mean that it would not be considered as a potential treatment in the future if further research provides evidence of its possible benefit. We need to determine if treating CCSVI improves symptoms or changes the course of the disease in any way. That is why the Society is leading research efforts to determine how CCSVI may be involved in the MS disease process. Martha, with this knowledge, had a decision to make. She could book a plane to Mexico and get the surgery. Her symptoms could improve, or they could not. She could also just continue with the physical therapy and get progressively worse every day. Martha knows that with time and research, the cure for MS is the next step in this dilemma. Martha knows we will soon live in a world where MS is 100% curable.